So let me talk a little bit about the background around hip fracture. This is very brief. You only get one slide this time. It used to be about 5 or 10. So about 9,500 people in Ontario will experience a hip fracture this year. And it's been really interesting as we've been looking at the data. That number's been fairly consistent. Although certainly you hear in some of the research that there are some decreases in the numbers of hip fractures, which is great to hear. However, it is still a significant problem. It's actually one of the most common injuries that require hospitalization. So it's an important one that we need to get right in terms of caring for these people. It occurs most frequently amongst those that are 65 years of age and older. And of course, with that, that brings some of their own very significant issues, as we've heard about. It causes significant issues with mortality, morbidity, and most importantly, a loss of independence. And that's really the key factor that we're trying to make a difference with the model of care. So this is our model of care for hip fractures. This is the version that was developed in April. It has been modified. We've been taking it forward to several national conferences to share some of our work and ideas. So I think it's fairly universal for Canada. So what does the model of care offer? Certainly it's an integrated model of care that focuses on optimized care that works from the emergency department through to surgery, through acute care, and through early transition into the inpatient rehab unit. It's built on the foundation of optimized best practice and includes seamless transitions between the various aspects as the patients flow across the system. It includes ideas around geriatric principles. It focuses on standardized discharge processes. And the real focus is on how do we return these people back home. Going into a little bit more detail, so certainly we have two streams of people. Those that are coming from the community, whether that's from home, a retirement setting, some kind of independent living environment. And we also have a group that are coming from long-term care. We've added in a section around surgery. That we need to make sure that there's pre-op medical stability that's happening. And again, there's some guidelines and expectations that need to be happening to really optimize that pre-op period of time for those individuals. Particularly one of the areas is around initiating planning around delirium management, dementia, and depression management, so that right from the get-go, we're actually working to prevent and manage that very serious consequence for many hip fracture patients. We next move into the acute care phase, where we're really looking at a length of stay of 5 days in acute care. And again, it's really on optimized care. How do we get these people mobilized? How do we deal with the medical issues? How do we get those catheters out, the IVs out? How do we help this population to be as good as they can be to be successful in transitioning into rehabilitation? People often ask me, what does optimal care look like for the hip fracture population? And we've talked about a lot of things, and I think that this slide gives a very good overview of some of the pieces and components that people need to be considering in their care maps. Certainly within the TGN project, within the Bone and Joint Health Network project, we've been using the idea of clinical pathways, and those clinical pathways have incorporated many of these ideas that are important. But I think this is a little bit concise. Certainly we need to look at access and patient flow across the healthcare system and make sure that that's built in to our model of care. And some of the components of that is certainly around the idea of timely surgery, that there needs to be ways to facilitate transition between services. And I think that this is sometimes the most challenging areas, particularly between acute care and inpatient rehab. Optimal clinical practice needs to include a number of things, certainly surgery that can maximize functioning. The idea of a clinical pathway, I think healthcare professionals find very helpful to actually meet targets and move people through the system. There needs to be optimized medical care. And in some cases, this may be some access into geriatric services where necessary, although the idea is to build capacity within healthcare professionals generally to be able to work and deal effectively with this population. And lastly, and most importantly, is the community care, and how do we connect in with the resources that are available through the CCACs and other community services to really support this individual to get back home when they're ready to go. Lastly, the whole area of secondary prevention is really important and a key in bringing into the care map. The idea of osteoporosis management, and we've certainly heard about that this morning, and we'll be hearing quite a bit more about that from Dr. Bogosh later this morning, and what that might mean as you bring that into your clinical practice. And also the idea of falls prevention needs to also be considered to prevent further falls in the future. So, from the Bone and Joint Health Network's perspective, what we've tried to do is really develop a toolkit of information and also specific tools that you can take back to your organization as you begin to operationalize some of the clinical pathways. There is a whole range of materials that are available. Certainly from the Orthopaedic Expert Panel, there is some guidelines and some direction for orthopedic surgeons around surgical practice that will optimize function. There are care maps for acute care, inpatient rehab, as well as guidelines for the CCAC. There are pre-admission order sets, and they seem to be quite popular, that's for sure, from such places as Mount Sinai, Trillium, and Credit Valley. There's also some performance management tools, and people sort of wonder when I talk about those, but they actually tend to be the most key things in actually identifying the changes that you need to be making within your own organization. So this is our process indicator report, and this is looks at, you won't be able to read the detail of this because there are over 70 hospitals that are part of this, but it does give you a picture of the flow of what's happening. For those of you that saw my previous slide from March 2009, there was a lot more white in that slide than there is now, and we're beginning to see a number of target dates that are being set for the fall and into the early winter of this year as people start to mobilize and think about what it is that they need to do to make a difference with this population. Certainly our goal is that most of this will be all colored in. So as you can see, we still have a ways to go, but I am encouraged that we are going to be moving forward. So what are some of the enablers for success? And certainly I've had an opportunity to observe a number of organizations as they've moved forward with this project. And certainly the idea of vision, commitment, and belief is really important, that in fact there are better ideas around managing this population, and that we can and will improve care for this population. And I usually find that once organizations become committed to making that difference and really can commit to a plan to make those changes, they begin to happen. The focus on returning patients home. We heard this morning about the costs of somebody going home versus going to long-term care. I sometimes think that long-term care decisions are made very early on in the process, and I really challenge you to think about what challenges do we need to overcome to get this population back home. Certainly, if we can get them home, they do better, their quality of life is much better, and there's certainly the rewards around the healthcare system costs as well. And lastly, there needs to be a system for performance measurement that we can continue to monitor this access, the quality, and the efficiencies for this population. And it's really only with that measurement system and the feedback to you that you can make sure that you're following and keeping on track in terms of caring for this population. So as we go forward together on our journey, I'm certainly available to you as a resource. I know Rona is available as well, and let's see what differences we can make for this population. Thank you very much.